Hey guys, this is part 3 in a series about hair transplants. We are following my friend Matt as he gets a hair transplant in Istanbul and recovers and regrows his hair. This is that video where we are looking at the actual hair transplant itself. Viewer, be warned, there is some graphic imagery in this one, some blood, some injections, the actual hair transplant itself. So turn away if you are queasy. And hey, quick introduction. My name is Adam Hurley. This is Blueprint by Adam Hurley. I am a men's grooming journalist, and Blueprint is where I put all of my experience into one place. I've been writing for GQ, Men's Journal, Robb Report, Forbes, all of them for well over a decade. And at Blueprint, we cover all the aspects of men's grooming. We've got fragrance, skincare, hair care, hair loss, hair transplants. So let's get into it, right? And if you are curious about the rest of this process, the day before the transplant, Matt's own personal story, the eventual recovery and regrowth, that is all in this series. Matt's hair transplant took place in Istanbul in May of 2025, and we are going to be tracking him all the way to the end of 2026. We'll look at him all the way up to the first year, and then we'll jump ahead 6 months at the end there just to see how it's looking at 18 months. We will be updating this series all throughout that period with lots of frequently asked questions, concerns, things like that, just to make this one really big, comprehensive hair transplant in Istanbul resource. This entire hair transplant series was made possible by the Hair Alliance. The Hair Alliance helps people like you get matched with the perfect hair transplant clinic based on any number of factors. Contact them with any questions or to get started at thehairalliance.com. or use this QR code. All right, now let's get into the actual hair transplant procedure. So you are able to have breakfast this morning, but I please advise you to avoid caffeine. The shuttle will take you from your hotel to the clinic. Now, Matt did choose to get buzz down. It's much better for the before and after photos, of course, but you don't necessarily have to buzz off your hair. I recommend it personally. I think it's nice to see the progress overall. Plus, you're just going to be dealing with a really awkward month ahead anyways. So by the end of that, you will at least have a buzz cut's worth of hair. And regardless of if you choose to buzz the tops and the sides, they are going to have to buzz the donor area where they're extracting those follicles from. If you just buzz it all down, at least it looks uniform as it all grows out. All right, next they're going to cleanse your scalp, disinfect it, and they're going to administer the anesthesia. This is typically twofold. They will give you general anesthesia. It's a really low-grade anesthesia. If you aren't averse to the general anesthesia like that, I really would recommend it because it is going to make a 6 or 8 hour day feel like 2 or 3 hours instead. Then they're also going to give you the local anesthesia. That is the injections around the top of your head at the site of the extractions and the implantations. And honestly, this is the only part of the procedure that, in my opinion, really hurts. Some clinics might also offer oral sedatives if you don't want to do the general anesthesia. Just something you have to talk about with them regarding your own preferences or concerns. Now, I don't want to get too in the weeds on the different types of hair transplants that are available. However, know that there are two main types that we can categorize things as. There's the FUE and the FUT. FUE stands for follicular unit extraction, and FUT stands for follicular unit transplantation. That's the method where they can remove a strip of skin with your follicles in it and then extract accordingly. And that method does leave a scar. But now most people will go with the FUE method. This is the follicular unit extraction. It's where they can uniformly extract and then implant the hairs one at a time and just make sure that they take the hairs from all around your head and not concentrating on specific areas, so that when you recover, everything looks very uniform and normal, and no one's going to notice that you had hairs taken from the backs and the sides of your head. With both methods, the implantation is still perfect. You get the proper angling, you get the proper density. There's still a lot of control from the surgeons, from the technicians, in terms of making sure you get really good results. But let's focus on the FUE because that's what Matt got, and that's what most people are getting. They have this little punch tool that just goes around each little graft on the back of your head or the sides of your head, wherever they're taking that follicle from. and it just removes the follicles one by one. This little punch tool is maximum 1 millimeter wide. There's little, if any, scarring involved with it. It heals up really, really well. This extraction process will take a few hours depending on how many hairs that they are taking out. It will feel like a lot less time than that, I promise.
For me, my densest hair is on the sides of my head. And so the doctor explained to me when we were doing the control that they were going to take more from that, but it wasn't straight lines across that would be noticeable. I guess traditionally folks have more taken from the back.
And if you recall, in Matt's case, they were taking some hairs from the neck and the chin area to fill in some of the density up top of his head on the crown. Because the hair is a little different under there, it's a little thicker, it's a little more coarse, they only use that to fill in the top areas. They're never going to put that at the front of your hairline or anything like that. And it's only in the cases that need high volumes of hair being transplanted that they will resort to the neck or maybe even the body hair.
It did take a couple hours, but based on the anesthesia, the couple hours didn't feel that long at all. And the extractions themselves just sort of felt like little pulls. Those didn't hurt after the anesthesia was in place. So that part was relatively smooth and painless. There were only a couple times that I felt like the local anesthesia was wearing off. And I did speak up when that happened and they quickly addressed it. And then once again, I couldn't really feel what was going on beyond a general awareness, but it didn't hurt.
Now, Matt's process actually took 2 days, and I'm treating this video as 1 day. I'm just condensing it because most people will only take 1 day. Most people will move around 3,000 or 4,000 grafts max. That means that with the number of hairs growing out of each of those grafts being 1 to 4 hairs, you could be moving, 8, 9, 10, 12,000 hairs all in a session. And it's after they extract that they will start looking at each follicle, each graft under a microscope and sorting it by the number of hairs growing out of it. At this point, they're sorting all the ones and the twos specifically so that those can define your hairline. You really are going to want a soft hairline at the entry. And so instead of planting a bunch of 3s and 4s and making a wall of a hairline, this is going to give you a really natural look at the front of your hair. And that way they can also use lots of the 3s and the 4s, the more prolific grafts and follicles, to fill in the density around the crown or anywhere else that it's needed. So they're going to chill these grafts in a saline solution in the meantime, just to preserve them until the implantation begins. This is when they're likely going to make sure that you're awake. If you are doing the long day, they might be giving you lunch. They might even just be giving you a bathroom break and giving you lunch after the procedure's over. It all depends on how many hairs you're moving, when you get started. But when you do return to the chair, it is time for the incisions and the implantations. Depending on the size of the clinic you go to, you might have the actual surgeon doing the incisions, or you might have some of the most senior technicians doing them as well. Don't worry, all these people do this day in, day out. They are the best trained hands in the world at doing this. And it is these incisions that will determine how the finished hair transplant looks, because this is where you are defining the angle that the hairs are going to fit in. You're looking at the hair growth pattern on the head too. So the cowlick in particular, you need especially close attention in how the hair pattern works around the cowlick, around the hairline, the natural hair part. These are the things that they're looking for on your head and making sure that they mimic as they draw in the density, the new hairline, everything. And like I said, each of the grafts are placed individually in the incisions with precision. It is such a careful process, and it's a little bit longer of a process than the extractions. The extractions can go pretty quickly because they're just punching those follicles out, but this is the more careful, precise one. And you might be curious about the pain involved with this process too, and I will let Matt speak a little bit on that.
The most painful part was just getting the local anesthesia done, but it was pretty quick and then it was over. And most of the time is spent on the extraction, the transplants. And while that's going on, it was very comfortable. There's about 20 minutes of getting numbed up. And then after that, it was very painless.
This part of the process, depending on how many hairs you're moving around, probably takes 3, 4, 5 hours, could be more. but I will let Matt speak to how long it feels.
I was aware that it was taking a few hours, but it didn't feel that long because I was in and out of a semi-conscious state based on the anesthesia. And having that plan in place with the doctor before I went in also helped me feel comfortable with what they were doing.
They might even draw some blood if you've opted into doing PRP. That's where they're going to take your plasma from your blood from a centrifuge, and then when they inject it into your head, the platelets in that plasma have your body's own growth factors, and it really helps boost your hair growth and your hair's health. Another option that you have available is stem cells. Matt actually had both options done when he was at the clinic. You can see here behind his ears on the back of his head where they extracted some of the cell samples, and then they put that tissue into this machine and it grinds everything up and it makes your little stem cell solution. And then they also can inject that into your head the same way that they do with the PRP. So you are basically just getting a super boost for your regrowth and recovery. And then when you're done, you might eat if you haven't already. They will wrap up your head just to prevent any bleeding, primarily from the back. Just kind of like a big diaper bandage on the back of your head.
The dressing was not disruptive. I actually appreciated having it so that I was a little bit less concerned. I was obviously still taking care to not bump my head or rub my head against anything, and to take some of the bleeding and absorb it and not have to worry about that dripping. And it did make it a little bit smoother to go back to the hotel and get some rest.
The recipient area is going to be left open. Obviously, those wounds are fresh. They really need the hairs to take to the area. You don't want to be touching it. You don't want to be interfering with it. So for this first night, you're not going to wash it, nothing. You are going to prioritize staying elevated to prevent any swelling from moving down your face. You're going to sleep at an angle, whether that means building up some pillows or sleeping in a recliner. You figure that out.
I was definitely nervous about what the sleeping situation would be like in particular, but it wasn't as bad as I had expected. We made sort of pillow fort in the hotel room that I was able to sleep at an elevated angle and get pretty good rest. I mean, maybe not as great as a normal night, but pretty great considering the circumstances.
They will also give you some antibiotics, some anti-inflammatories, some painkillers, whatever you need to prevent the swelling, the pain, any risk of infection. That will all be given to you after the appointment, and some of those will also be taken in the following days just to prevent any lingering issues as well.
As far as pain after the procedure, when I went back to the hotel, there wasn't much to speak of. They gave me a handful of pain medication that I could use should there be any lingering pain, and I did take one at night the first couple nights just if there was any sort of discomfort, but that was more as a precaution than anything else because I didn't have any sort of lingering or debilitating pain.
In the next video, we will go over some of those general rebound instructions, things to avoid, things that are going to ensure the maximum survival rate for those grafts. In the meantime, know that whatever they give you that first day, follow their instructions to a T. That might also mean a saline solution just to keep the area hydrated. Whatever they give you, whatever they tell you, use it, do it. You got this far. Don't mess this up now. So stick around. We've got more videos, including the first 24 hours, that initial recovery, and then the first week, the second week, the first month, and onward. Thank you guys for watching. Please give this video a thumbs up. Subscribe to this channel for all the hair transplant updates, but also everything related to hair loss, fragrances, the best devices, the best products, the coolest brands, you name it. We talk about it at Blueprint. Leave any comments or questions below. Keep it nice, and we'll see you in the next video where we talk about the first 24 hours after a hair transplant. Again, if you are considering a hair transplant, please contact our partner in this series, the Hair Alliance, at thehairalliance.com or using this QR code.